Welcome back to Trauma Talks with Krystal Boothe, the podcast for people who have tried everything to heal their trauma and want real solutions so that they can get on with their lives. Whether you are working in the healing arts or in need of healing, this podcast is for you. Today's guest is Brigid Geary. She works in the field for 5 years and is a licensed clinical social worker. She is passionate about providing a safe and judgmental free space. She approaches each therapeutic session with the belief that the relationship with the client and therapist should be one filled with trust, empathy, and understanding. In her sessions, she utilizes an integrative therapy method, tailored therapy techniques to best support each of her clients' individual needs. Her experience has primarily been providing guidance and therapeutic services to the adult and the older adult population who are coping with anxiety, depression, grief and loss, and chronic illness. Through her work, she has helped clients learn or strengthen their tools to help them navigate life challenges, gain control over their lives, and find a greater sense of meaning and purpose, and better navigate challenges surrounding new or chronic health diagnosis. For Brigid, therapy is a space where you can be full of your authentic self. Okay. And it is never too late to start the process of transformation and healing. So I just want to tell you a little bit about this episode. Depression is a prevalent but an often overlooked mental health issue among older adults. So factors such as isolation, loss of loved ones, chronic health conditions, and life transitions can contribute to the development or exacerbation of depression symptoms in seniors. In this episode, we'll discuss the unique aspects of depression in older adults, its impact on their overall well-being, and effective approaches for prevention and treatment. So if you are an older adult or you live with an older adult, this episode is definitely for you. So we're going to go ahead and talk with Miss Brigid. Brigid, how are you doing? How are you doing?
I'm good. How are you? Thank you for having me.
Good. Good. We made it. Yay.
Yay.
Okay. So Brigid, let's just, first of all, I want you to just, you know, tell me what you think that we really need to be focusing on when it comes to working with older adults, because this is a population that some people kind of shy away from. What do you think?
Definitely a population I shied away from when I started, in the social work career. But after taking different courses and, I worked in inpatient medical settings, psychiatry, um, I just learned there's like all the different challenges that come along with getting older. And I think it's just they're such a vulnerable population. They can be, a lot of older adults live long, happy lives, but um, it's important to um, just realize all the challenges that come with growing older. And I think it's becoming more accepted now to treat older adults, especially after like the COVID pandemic and everything, where they were very isolated, especially in long term care facilities.
I see what you're saying. Yeah, so the long-term uh, care facility issue really kind of brought it to the forefront because people started to think more about what's going on with our older adults and how can we best serve them. So I appreciate that. I appreciate that. I know that they suffered a lot during the COVID and everything, especially with this particular topic that we're talking about today, which is depression and the seniors. And I do find that this is primarily the thing that they suffer from, and a lot of it probably has to do with isolation. But I wanted you to tell me, when it comes to this, what is the most pressing issue uh, with the depression in seniors? I mean, what is the most scariest part of this?
The message that I really wanted to get across is a lot of depression or anxiety symptoms. Many people can view it as like a normal part of aging, especially they might think, oh, they're just getting older, that's normal to be depressed. But a lot of older adults, I've realized, they internalize that message and then they're like, oh, I'm too old to change or get better. And that's just not true at all. So therapy really, I've realized, has really helped them realize that you can change and, make um, a difference in your life even when you're older. You can learn new hobbies. There's many things you can still do.
So there's some hope. It's kind of you. It sounds like you're going for the hope thing. I love that. So you're letting them know that there is some things that you can do to kind of mitigate some of this depression. And so I just wanted to ask you here, what are some of the common reasons why uh, seniors are depressed? To start with, let's just start the conversation here. What are some of the primary reasons?
There's, a lot of factors that can go into it. When I'm typically asking them about, their history, I like to ask if they've had a family history of depression, especially if they, are new to the nursing facility and, they haven't had depression before. Maybe someone recently passed away. Um, so they'll tell me that, and then they might tell me that a year before they lost two other family members. So it might have been something that was like building up, and they eventually um, started showing depression symptoms from all their losses. So a lot of them have several losses that they're dealing with.
Some of the factors that contribute to their depression is, like you said, COVID, um, losing someone, those types of things. What else? What are some other things that could get a senior that might be in a good space in life, and then all of a sudden they fall into depression? What could be some of the things that could get them there?
Yeah, so there's a few things that I see a lot. One thing is falls. There's a lot of older adults that they might have like weaker bones or just, not be taking care of themselves or being careful and they fall. They might hit their head and then lose their ability to walk or have a stroke. That's another big one.
So sudden health issues. Yeah, yeah.
And having strokes, yes, greatly increases your risk of developing depression for many reasons. But
Okay. Why is that? Tell me why that is.
yeah, so typically, a lot of them have changes in functioning when they after they have a stroke. They'll maybe
Okay.
not be able to use, their right hand or part of
Mhm.
their arm, and then they might slur their words or have trouble communicating as well.
Okay, wow, that's really important to learn. Yeah, because if you have an older adult that you might be taking care of, or that may be living alone, you might want to think about, you know, how you're going to support them, because once they have that stroke, then things have changed, possibly even forever. Could be permanent.
Yeah, exactly, and that's another, big thing. If they have a stroke, most likely a lot of caregivers have a very hard time being home 24/7 to take care of them. So that's typically what pushes them to go to a skilled nursing facility. And, when they're living there, they lose so much independence. They lose their community. They lose like the place they felt safe at home. And it's a very big risk factor for developing depression. Just leaving your home and going to a place that's very scary. There's a lot of beeping noises. It's very similar to a hospital because I've worked in hospitals and a lot of them will say, "I'll never get used to it living here."
I don't
hmm
blame them. I don't blame them.
I don't blame them either.
Yeah, yeah, you're making me wanna cry thinking
I'm
about
sorry.
what you're saying to me. Yeah, I'm getting no, it's okay.
It sounds depressing, but it's
No,
very rewarding. It's very rewarding.
no, I know it's very rewarding. It's
Yeah,
just I'm just thinking about them right now, and I'm just
yeah,
thinking about, you know, like, wow, they all of a sudden they have this, health thing, they fall or they trip, or, they're maybe before they're like moving around, doing everything, having a pretty normal life for the most part, and then all of a sudden they have this accident or they have a stroke or something like that, and then they go into this downward spiral that leads them to ultimately become depressed. And so, there's some unique challenges around being a senior. What are some of the ways that you address the depression once you realize that this is kind of catapulted? One thing led to another, and now they're in this depression, and they're a senior, and they're displaced from their home. They're placed in a senior care facility away from their community, like you said, and all of that. And now, what do you do? Where do you show up for them? How do you do that?
Yeah, so I'll typically get like a referral from the doctor if it's a new patient, or I will. So when I go in and if I don't know if they have depression, but somebody maybe suspected they did, I'll go in and a lot of them I've noticed don't like when you ask them like structured questions like, have you been feeling depressed? Yes or no. They don't like to like answer specific questions like that. So I like to like more just do a conversation with them, ask how they're doing, get to know them.
So be more off the rapport type building thing. I got you.
Yeah, and more of have like a connection with them, and not feel make them feel like you're just trying to get something out of them.
Because I'm sure they deal with that a lot. People trying to get them to do stuff that they don't want to do because they're older, you know? People try to take advantage of them a little bit. So, don't think they know what's going on. A lot of them know what's going on, let me tell you.
That's something that's very true. Even the staff members will be like they'll think they don't know what's going on and they know everything.
They know what's going on. You'd be surprised.
And they're also good at pretending they don't know what's going on too.
Isn't that interesting? How do you mitigate that?
That one's really tricky. I have a patient for sure. I was going to talk about her, but she does that. I think she has
Tell me
selective
about
like
her. Yeah.
she has like selective hearing. She only hears what she wants to hear.
How
So
do you work
she's
with a client like that? That's pretty difficult.
it is. She was one that when I first met with her, she was crying and just a mess. And I was, just trying to get it out of her, what was upsetting her, what was causing her distress. And at first, she just acted like she didn't remember. So she was like, I don't know, I just forget everything. I don't know what's going on anymore. And then I got it out of her that her partner was sick. He was having health issues. So, and she did that with many other things as well. But it's like she wanted to talk about it, but she was scared to be, I think, vulnerable and share what was going on. So I just had to develop, a rapport with her and try to make her or have her trust me, because trust is a huge thing with older adults. And a lot of them, even I've noticed, they'll be like, say things about how young I am.
Do they think that you know enough to help them?
Fortunately, I think because I have much experience, like with the medical field, I think it makes a big difference.
So you're able to let them know immediately that "No, I'm pretty skilled here."
Yeah, and I can say like I've seen this before, and I've talked to a lot of caregivers, so I've heard a lot of different stories. But I think for a younger therapist, I can see how it would be difficult, just because they might, underestimate like what your knowledge and your competence.
Mhm, mm. I think that's a unique challenge with this particular population because you don't really have that in the other populations. They pretty much they're good, but the older population, yeah, I could see this being a unique challenge. Um, so how does retirement and all of that factor into this? Um, Loss of loved ones, health conditions, impact. How does this all, the mental illness, how does all this factor together in determining how you treat someone with that is dealing with depression?
Yeah, it's very individualized. I think it depends on, if they've had therapy before, um, how motivated they are, maybe what their goals are. But I think just making sure that like I said, gain their trust and make sure that they know that you're gonna like they can rely on you, like you're consistent. That's another big one, being consistent. Otherwise, they might think that you're abandoning them. I have some of those, and it's very yeah, it can also be, just emotionally challenging too.
You guys make sure that you like, share, and subscribe to this so that you could get more content like this, like what Bridget is sharing with us today. Because this is a very complex area when it comes, because it's very very detailed, very intimate. Being with the older adult, I know working with older adult populations, you have to approach this in a very very professional, but yet very person centered approach, I guess you could say. You know what I mean? Personable, relaxed, because they're not used to therapy. They're not used to a lot of the things. They're from a totally different generation, where there wasn't therapy wasn't looked upon as something that you do or go to. And not everybody, not all adults, older adults, but a lot of them, they shy away from this sort of thing. So make sure you like, share, and subscribe, and stay connected with us so we can continue to help you navigate these very unique challenges, such as this. So, just let's talk about some of the signs, and we're going to move on and talk about the signs. What are some of the key signs and symptoms of depression in seniors, that people, so that they can be able to identify if they're in a situation like what we're talking about today? What would we notice in that older adult?
Yeah, so I would say the main ones, they are a little bit different than like a younger person might have. They they like complain more of like body aches, pains, fatigue. A lot of them have sleeping issues too. They might have a change, like they might sleep too much, but a lot of them have trouble sleeping. So they'll say, I only got 2 or 3 hours of sleep. Or they'll say they woke up, went to sleep, and then woke up too early. So, and then another like two more big ones I'd say are difficulty with memory and concentration, which that sometimes people might think, oh, they're just developing dementia, or um, even though it could be depression. And irritability is also a big one. They might have issues with their roommate. I had a patient who her roommate became started becoming very irritable and mean to her, and she she was showing all the signs of depression, and irritability was like the number one symptom that I saw in her.
So when she's got all these, when she started to notice all these things, did she reach out? I mean, how did she get in touch with you so that she could get help for her older aged mother, or anyone, aunt? It could be any older adult that you might know, be connected with. What did she do? How did she get from seeing these symptoms in her to knowing that that's what she needed to go to was you?
So the thing with older adults is a lot of them don't come to therapy. They're referred, and then when I go meet with them, I'll ask, I'll just introduce myself, what I do, and I'll ask if they're interested. And, if I can complete an assessment with them, talk to them for about 30, 40 minutes. And then if I determine whether I'm going to provide treatment, or if, maybe I'll check back in with them in a couple weeks if I don't think it's necessary. But, um, yeah, it's something that they're all individual, and you have to, take it case by case.
And you know what? I didn't even know. What's so funny what you just said about that being irritable. It's funny to me because actually that is a symptom of depression, but a lot of people don't know that. They don't
Mhm.
know that a person is irritable, that depression. They actually think that they're, just a grumpy old, they always say grumpy old man or grumpy old lady. And the
Yes.
fact of the matter is, that's actually a symptom of depression. Could you give me some more subtle indicators of depression that might be overlooked in older adults?
Yes, weight loss is another big one.
Okay, wow, I didn't think of that either. Wow.
Yeah, especially in nursing homes, they'll start refusing their meals because they have to eat whatever's there a lot of the time. But just in general, they might not feel like eating. Depression can cause, you know, significant appetite changes. So they might even start eating more, or having cravings for certain things. One patient, she'll always ask me if I have a snack, or if I can get her a snack, every single time I come to see her.
Wow, so cute.
Mhm. Yeah, but I do have another
Adorable.
one.
They're so adorable to me. I love them. They're so
They're
adorable.
so adorable. Yes,
They're
there's
the children and older adults are my favorite. I could cry, yeah, just my favorite. Yeah. Yeah,
Yes.
so wow, so you don't even know and you're thinking you're getting mad at it at the, you know, older person and you're thinking that they're just a grumpy old person and in fact they're actually going through some serious depression and loss and health issues and this is a lot to deal with. So wow, what else can you tell me about the subtype indicators, because I think that people need to know a lot about that so that they can differentiate between one thing or another and know how to get the older adult to the help that they need because they can live a good life in their older days. A happy life, actually. It's possible.
Mhm. Yeah, I think there's a few more, like, feeling hopeless or helpless. Hopelessness is a big one. They might start just saying a lot of pessimistic things, like, "Nothing's ever gonna get better. Nothing's the same. I'm just gonna be like this forever."
Like you're trying to feed them or give them some food and they don't want the food and they're like, I don't want that. And you're like, "Oh, what's wrong with you? You know, I don't even know it, but it's depression. This is hilarious. I mean, it's not funny, but it's less funny in the sense that how we depict that kind of behavior in our society that's actually depression in
Mhm.
an older age person. Yeah.
Absolutely. And I
Yeah.
think there's a big difference between grieving also and depression, because a lot of times they'll be sad because they lost, a family member or anyone, a friend. Um, and it's depression might mimic grief as well, but typically in grief, you don't lose a lot of self esteem or feel worthless and things like that. And it's kind of like a wave for grief that comes. The feelings come and go, so you're more able to manage it than depression.
And so what can we do to prevent some of this? I mean, is there any prevention that you can do? What are some of the main things that we can do to prevent depression in seniors early or either early intervention, I guess you could say. Yeah, probably early intervention.
So a few things I think would be to make sure that the older adult focuses on self care, especially like when they're around retirement age, and having like a daily plan, like I'm gonna retire and then I'm gonna do this every day.
That is excellent. That's an excellent yeah, I like that. Yeah, because if you don't have a plan, that's right. They gotta have a plan. You have to have a plan for, help your older adult have a plan for their retirement. Yeah, totally. What else?
I would also say staying physically active if you can, like walking or um, whatever is safe for as you get older. But I think also a lot of medical issues and changes in functioning can affect that. But as much as you can be active, um, I think that's really important, and just staying connected to other people. So maybe FaceTiming family more or friends more, if you can't see them in person.
Setting them up with those kinds of tools that they can have outlets, walking, FaceTiming, just feeling like they're apart because a lot of older adults do live alone, huh?
Absolutely, and even if they live in a skilled nursing, where I see them, long term care, they might not have family that comes sees them, or they might not have any family around. And the nurses are busy. They do what they can, but if they don't have a roommate, they might not interact with many people at all during the day.
Are there any social or environmental factors that play a role in a person getting depression or becoming depressed?
For sure. I would say in the nursing facility, at least where I see them, there's a lot of different relationships that they form. They might be like re-triggered, especially by a roommate if they're loud or noisy or.
Because they're living with other people now. They could get triggered with their I just thought about that. They could even get triggered with their family of origin, their their daughter or their son or whoever they might be staying with, or even in the nursing facility with, yeah, with their roommate. Yeah, wow, that's true.
So I see that a lot with roommates. They'll request a roommate change, or they'll just a lot of them will have to deal with it just because they can't keep switching rooms. But it is something that's really difficult for them.
What do you tell them when this is going on, Bridget? What do you say to them when they're unhappy with their living conditions and they're older?
Yeah, so a lot of times I'll have them like reflect on why something's bothering them, or if it's like bringing up like past memories of something, because a lot of times they will remember something from the past that someone else did, or somebody said something mean to them, and then if the roommate says something similar, it can really affect them.
So triggers. Triggers for the
Yes.
depression, yeah, totally. What are some other triggers that the trick that because like you said, being displaced and being in a older age home or either being with a family member can, trigger them for whatever reason. Are there any other triggers to depression in older adults?
Yeah, so I would say just the loss of like community and the loss of like loved ones and friends even. They might lose. I have a patient actually. She lost 3 people in 1 year, and she has a sister that's around still, but the first person she lost was her mom at the age of 13. And she said even after all the losses like recently she's had, her mom's loss is still the most challenging one. So she tells me that she's trying to grieve, you know, the loss of these recent ones, but she hasn't even got there because she's still grieving the loss of her mom. So it's like it's just adding on to her depression.
Wow, wow. This is very important, very good information you're sharing with us so we can be able to navigate things. How many things that we can avoid, problems that we can avoid just by becoming knowledgeable. That's why I want all of our guests out there to, please, I want you to, if you guys want to communicate with Bridget or could get to find out Bridget could help you with your older age, uh, uh, family member, please don't hesitate to, we're going to make sure we put all of the information for her on this video so that you'll be able to reach out to her, and also remember to like, share, and subscribe so we can continue to bring you really good content to help you navigate these areas of mental health or depression or trauma or any of the things that a lot of us are being faced with in this day and age. So I also have a couple more questions for you, Bridget, because you really helped me a lot um, with this topic. This is not really my topic that I know a lot about, and actually learning from you, and I know the guests are learning from you as well. So I really appreciate you coming on today. Um, now that we talked about these risk factors and everything, let's talk about some barriers to treatment because now we know what the problem is. We can identify it when we see our older age person. Um, what are some of the barriers to them actually getting help? Because just because we know it doesn't mean we do anything about it, you know?
Yeah, I would say there's even physical factors. I'll meet with a patient and they might not be able to hear me very well, um, or they might not be able to like see very well. They might have difficulty like remembering things. Um, but I would say the hearing impairment can be a big barrier, especially when um, like, if you're wearing a mask, you can't wear a mask when you're talking to them because they have to read your lips, I would say, like, 90% of them.
Wow, yeah, yeah,
And
that is a barrier.
even if they can understand me, they'll, like some of them I know they'll pretend they can't understand me because they want me to take my mask off just because it's, like, more comfortable for them.
I didn't think about that because then we also have Alzheimer's. I just thought about it. Like, sometimes the older adult has depression, but they also have Alzheimer's. That's very complex. Have you ever seen anything like that happen? come across your practice?
Yeah, I would say like a good handful of those that have dementia, and they for sure benefit from, me seeing them. They have really good long-term memory, so they will, there's a few that'll tell me about them being in World War II, and it'll really help them feel better to be able to talk about their experiences, and it really, improves their mood, especially if they like, they really enjoyed that time of their life. So, um, they also, they just having that connection with somebody really helps them, um, just like feel better and feel supported, especially if they don't have anyone to support them.
That's major. That's
Mhm.
major. It's major work that you're doing there, Bridget. Really
Thank
appreciate
you.
you helping the older people. Those are my. I'm like a crybaby when it comes to that. So don't get me started, because I love older people. I love my grandmother. She was my favorite
That's
person in
yes,
the whole world. Yes.
same, yes.
So you have to have an understanding for older people and the value that they provide to the human race, and you know just getting us, it taught me how to cook, cook the food that I'm cooking today is the reason that my grandmother taught me how to cook that. So we got to take care of our older adults, and we got to be there for them, and we got to learn how to work specifically as therapists. We got to learn how to work with them and get the results, because some of them have trauma that they never dealt with. Sometimes the depression comes from trauma. Have you ever seen that happen, where they're having the depression? It's not going something that's going on in their life currently, but it's something that happened long ago. How do you navigate that trauma with an older adult, and it manifests in the form of depression?
I've seen that a lot, but there is one patient, she will bring up often that things that she's guilty for or she feels guilty for in her past, that a certain situation she didn't handle how she wanted to.
Oh, so some regret.
Yes, lots of regret and guilt that she didn't
Mhm.
live up to her parents' expectations,
Yeah.
and she had a lot of low self-esteem because of that. And that's why I really like your new book, because it, it talks about like self-compassion, and I really had to work with her with, being more self-compassionate with herself and forgiving herself, because she would just like be so hard on herself because of that mistake, and she couldn't get it out of her head.
Oh, you are welcome to use that book with her or any of your clients anytime, teaching them how to have empathy, because that's the thing that changed my life. I did not know how to have empathy for myself. Even though I had gone through a lot in life, I didn't know how to give myself the empathy, and I didn't realize the power of empathy and how you could use empathy to actually heal those kinds of things, trauma, which I didn't know. And so I definitely recommend it for anyone, for my life, for your life, for older adults, because sometimes it's something as simple as realizing that, you know what, at the time you did the best that you could under the circumstances that you were in, and really explaining them, helping them to see that. Even people who are teenagers who may even have a hard time, being compassionate and loving towards themselves. So I appreciate you saying that, and I appreciate you considering that, to use those kind of tools, because I think they work. I really do. I've experienced it myself. Um, so how can healthcare providers and community organizations better support seniors? Because we want to get them involved. Because the community, they're always saying we're doing something for the for the older age. We're doing something for the older age, and I want to see more of it. To be honest with you, I'm not fully impressed. What can we do, uh, Bridget? Because you're the authority here. Because I have my little small experience with older adults, but you work with the older age in the care facilities. You're right there in the trenches with this whole situation. What can we do? We want to help them. You know what I mean? Older adults.
I think making sure that they I know doctors are really busy and they have a tough job, but making sure that they, take the time to get to know the patient, and make sure that the patient's comfortable asking questions, and just giving them the opportunity to say how they're feeling and what their concerns are. Um, 'Cause a lot of times they feel powerless, in these facilities. They feel like they're almost, like, institutionalized. I'll hear that a lot of the time. They feel like they're in an institution, so they just feel like they don't have any control and powerless, so, just letting them have a voice is really important, um, for clinicians to remember.
I really appreciate that, what you're doing, because everything that you just said is so amazing. If people can just do those simple little things, they'd be surprised. It's the doctors and everything just taking a minute, listening to what they have to say, letting them ask all their questions. Even if you think the questions are stupid, it doesn't matter. It doesn't matter. You know what I mean? Because no, I'm serious. You might think, oh, why are you asking that question? Or I know what I'm doing. Sometimes we as professionals, we're very in a rush. We're always in a rush because we have the next patient is already sitting in the lobby waiting to be seen, and we're rushing. So but hey, if I don't get everything that I need to get done today in this room, then hey, can I book another appointment with you? Do you have time? You know what I mean? I try to get them in as soon as I can and talk to them some more so that they can make sure that they get heard and they feel seen. They feel seen. Be surprised how much that can extend a person's life.
Yeah, and I think also, even for doctors or therapists, whoever is seeing them, a lot of times you look at their chart and you look at what their history is or why they came to the facility or hospital, and you might like put thoughts in your mind, oh, like this patient's going to be annoying or like difficult or something. But sometimes, a lot of the times, you meet them and they're like nothing like you expected. So
Mhm,
just
mhm.
not having like you know,
Preconceived
pre
notions.
yes, that like you're gonna like them or not like them,
Yeah.
because you never
'Cause
know, yeah, what you're gonna encounter, even though you read like a note.
And I think the biggest thing is hear the person's story. I love to hear their stories. They always have the greatest stories that you know what I mean? And they always are willing to share those stories. Tell me more about I always tell me more. And they're telling, and before they know it, they've almost fixed their own problem. Like, oh, okay, yeah, I do realize that I was da 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 da. And I was kind of, and oh, I realized that I am kind of sad about being divorced and even though it was 40 years ago, it's like, yeah, you still feel sad about that. You were divorced 40 years ago. That was a big deal. And you never talked about that. So now I'm glad that you came into we came into connection through whatever, maybe a health issue or whatever brought you in to receive these services. But now you're actually getting to deal with some of the things that you probably didn't even think you needed to deal with that were actually bothering you.
Yes, I'll see that a lot. Even like when after I've seen them for 3, 4 months, they'll tell me something like drastic that happened, and I'm like, "I never knew that about you." Like one of them told me that she got hit by a car when she was younger. Yeah, like really young, and the driver didn't really get in trouble because it was like before there was like strict laws. And it was really traumatizing for her, and I didn't know that was even like part of her life. So it took her a while to open up about it.
Wow, and especially when you don't think that it mattered to anyone else because at the time they didn't even have the right laws to protect people when it comes to driving. And so you may not think that no one cares. So you may not bring it up because it's like, oh well, that's kind of that whole thing where it's almost like there's no empathy in the world kind of thing. Like, I guess you could take my book to another level when you say, there's no empathy, you don't have empathy for yourself, but then maybe the reason why some people don't have empathy for themselves is because they don't feel there's any empathy in the world. Right? There's no one really cared that you got hit by a car and it's a big deal. I mean, you could have died, and even if you didn't die, you probably broke some bones or something happened, and no one took the time to even sit you down and say that this matters. This is a big deal. We have to talk about this.
Yeah, and I could sense a lot of anger when she was talking about it. And after all these years, there's a lot of anger in her, and I always got a sense of her that she had something like some anger inside of her, or something wasn't right with her. Just like she felt like she was unhappy about something, and then when she just talked about it, it seemed like it was like she because she had it caused her like physical health issues for like the rest of her life. So I think she just has a lot of built up feelings about it that she likely hadn't like talked to anyone about.
This is major, major. You're changing the world over there, Miss Bridget. You're changing the world.
I'm trying,
I'm
yeah.
telling you,
It's
you're saving
very you
many
see it.
grandmothers. Yes.
Mhm. Yeah, it's also it takes some time with older adults, so you don't see the the effects for a while sometimes. And but it is like when you see the differences and their behaviors and mood, you
Heck,
it does.
it matters. Yeah. You care. It matters. And that's great. I'm glad that you had that good grandma, because goodness, what if you didn't? We wouldn't have
Yeah.
you. Helping the other people. I mean, we're making a big difference because I mean when you help them, then they're able to then go and be with their grandkids and do the job that a grandma does. Because sometimes they think that the grandmas aren't coming around, but sometimes these grandmas have trauma and depression and stuff going on while they're in their room all day and they don't want to come out and they don't want to talk to anyone, and they're thinking, well, what's wrong with grandma? She's just grouchy. And it's like, it's more to it than that.
Yeah, and a lot of them don't they say they don't wanna burden other people,
Oh,
they
yeah,
don't
that's true.
wanna,
We like
bother
that.
them, they're busy, so I really encourage them to contact. Hmm?
Yeah. What were you going to say? I'm sorry.
Oh, I was just gonna say, I really encourage them to, reach out to their family and not always just wait for them to call, because they'll do that a lot of the time.
That's amazing.
Mhm.
That's amazing because if you tell them, if you just tell them to reach out, maybe they're like, they wanted to reach out, but they just needed someone to kind of give them that nudge. Just go for it. It's gonna be fine. Just call them, and then before you know it, they're having a great Christmas with their family again, and they're back with their family because some of these older adults get disconnected, or sometimes you have to have surrogate family because sometimes family isn't family. I mean, let's just talk about it.
Yes,
Yeah,
definitely.
yeah. So some surrogate family can also help. So anything else that you wanted to tell us about this topic that is so you got me all engrossed in it. I'm like, oh my God, this is major because I love older adults and yeah, I feel like they are the ones that are going to be helping the young ones kind of get their act together a little bit there, and so if they're not taken care of, how can they do that? So anything else that you want to say about this topic? I have so many things that we could go on and on and on. We can even have another part two on older adults.
I think there's a lot of things that, yeah, I could talk about too, but I think for clinicians at least that work with older adults, I think it's really important to like just acknowledge how hard it is, especially to be around people that don't feel well. They might be in chronic pain physically, emotionally. And if you're like an empath like me, you might like feel the pain. Like sometimes I like feel like my muscles like get tense if I'm around like someone in chronic pain a lot.
Okay. Wonder why is that?
It can be really just difficult to watch someone be in like chronic pain, and it's just so like
So
it's almost.
you're almost an empath or something. Am
Yes,
I
definitely.
like
I'm
you're an
like
empath?
it's like a physical empath. Like I can feel like their physical pain sometimes.
Yeah,
Yeah.
you're an empath, mom. You're an
Mhm.
empath.
Yes.
You are an
Mhm.
empath. Yeah. So, oh wow, Bridget. So you're an empath. So you can feel their pain. So that's why you're able to do this work. Because I'm listening to you talk about it. I'm like, she's very good at this. She's very insightful. She knows what's going on. She's doing a really good job. And not everybody can do such a great job like that. And so, I want to remind everybody, this is Brigid Geary. She's come on the show, you guys. Remember, please reach out to her if you have any older adults that you need her to work with you on, or if you need her to consult, you need to consult with someone, even just consult. Can you do consulting work? Just consult with someone, even if they're not doing actual therapy with you,
Oh, for sure. Absolutely.
you know, or something, because sometimes you might just need to consult, or you might just want to bring her in and, do therapy or, do a phone call or something, about the matter. But we want to make sure that, you know, that there is help in this particular area, in this special area of older adults with depression. Okay. So, we want to empower. the seniors. We want to empower you on this show. So we want you to please, please, please like, share, subscribe. Don't forget to do that. Don't forget to connect with us, and don't forget to look out for this when you know the next show when we complete this. So seniors, we want to help seniors. So is there any resources or anything you want to give to the seniors to help the seniors who might be watching this show too, and just in case were their caretakers?
I would say just to, like I said, make sure that you are having like a daily routine if you don't have one. Just to stay, busy during the day. A lot of times I see patients just thinking over and over all day, and it really gets their thoughts, ruminating, and they might think of more problems they have or more things. So staying busy is really important, especially with your mental stimulation. So just making sure that you're maybe doing crosswords or like learning a new skill like knitting or something like that. Some anything to keep your mind active.
So staying active, very, very, very important. That's true. That's true. Rounding up the show here today, we appreciate you, Brigid, for coming on. Thanks for joining us on Trauma Talks with Krystal Boothe. Stay tuned for our next episode where we'll continue to explore trauma, mental health topics. Until then, take care. Remember, there's hope in every journey. Okay? Have a great rest of your day. Bye.